Hi everybody, today I'm going to talk about another important topic, and that is also related to gynecology. And this is a very common issue which we come across in our medical practice. I'm talking about menorrhagia, that is excessive or heavy menstrual bleeding. Menorrhagia is the medical term for menstrual period with abnormally heavy or prolonged bleeding. Although heavy menstrual bleeding is a common concern, most women don't experience blood loss severe enough to be defined as menorrhagia. With menorrhagia, you can't maintain your usual activities when you have your periods because you have so much blood loss and cramping. If you dread your period because you have such heavy menstrual bleeding, talk with your doctor. There are many effective treatments for menorrhagia. Now I'll tell about symptoms of menorrhagia. Signs and symptoms of menorrhagia may include soaking through one or more sanitary pads or tampons every hour for several consecutive hours, needing to use double sanitary protection to control your menstrual flow, needing to wake up to change sanitary protection during the night, bleeding for longer than a week, passing blood clots larger than a quarter, restricting daily activities due to heavy menstrual flow, symptoms of anemia such as tiredness, fatigue or shortness of breath. You should see your doctor when before your next schedule exam. If you experience vaginal bleeding so heavy it soaks at least one pad or tampon an hour or more than 2 hours, bleeding between periods or irregular vaginal bleeding, or if you suffer from any vaginal bleeding after menopause. So in this case you must see your doctor. Okay. Now let me tell you the causes. In some cases, the cause of heavy menstrual bleeding is unknown, but a number of conditions may cause menorrhagia. Common causes include hormonal imbalance. In a normal menstrual cycle, a balance between the hormones estrogen and progesterone regulates the buildup of the lining of uterus, which is known as endometrium, which is shed during menstruation. If a hormone imbalance occurs, the endometrium develops in excess and eventually sheds by way of heavy menstrual bleeding. A number of conditions can cause hormonal imbalance, including polycystic ovary syndrome, obesity, insulin resistance, and thyroid problems. Then the second cause is dysfunction of the ovaries. If your ovaries do not release an egg during a menstrual cycle, that is anovulation, your body does not produce the hormone progesterone as it would during a normal menstrual cycle. This leads to a hormonal imbalance and may result in menorrhagia. Then another common cause is uterine fibroids. These non-cancerous benign tumors of the uterus appear during childbearing years. Uterine fibroids may cause heavier than normal or prolonged menstrual bleeding. And then there is another cause, that is polyps. Small benign growth on the lining of the uterus, that are uterine polyps, may cause heavy or prolonged menstrual bleeding. And then there is a condition that is known as adenomyosis, in which the glands from the endometrium become embedded in the uterine muscle, often causing heavy bleeding and painful periods. Another cause is intrauterine device. Menorrhagia is a well-known side effect of using a non-hormonal intrauterine device for birth control. Your doctor will help you plan for alternative management options. Then another cause is pregnancy complication. A single heavy late period may be due to a miscarriage. Another cause of heavy bleeding during pregnancy includes an unusual location of the placenta, such as a low-lying placenta or placenta previa. Cancer. Uterine cancer and cervical cancer can cause excessive menstrual bleeding, especially if you are a postmenopausal or have had an abnormal pap test in the past. Then there are some inherited bleeding disorders which can cause menorrhagia. Some bleeding disorders such as von Willebrand disease, a condition in which an important blood clotting factor is deficient or impaired, can cause abnormal menstrual bleeding. Medications or certain medication also can cause menorrhagia. Certain medication including anti-inflammatory medications, hormonal medications such as estrogen and progesterone, and anticoagulants such as warfarin, which comes with the name of Coumadin or enoxaparin, can contribute to heavy or prolonged menstrual bleeding. Then there are some other medical conditions which can cause menorrhagia. A number of other medical conditions, including liver or kidney disease, may be associated with menorrhagia. Now, coming to the risk factor vary with age and whether you have other medical conditions that may explain your menorrhagia. In a normal cycle, the release of an egg from the ovary stimulates the body's production of progesterone, the female hormone most responsible for keeping periods regular. When no egg is released, insufficient progesterone can cause heavy menstrual bleeding. Menorrhagia in adolescent girls is typically due to anovulation. Adolescent girls are especially prone to an ovulatory cycle in the first year after their first menstrual period, that is menarche. Menorrhagia in older reproductive age women is typically due to uterine pathology, including fibroids, polyps, and adenomyosis. However, other problems such as uterine cancer, bleeding disorders, medication side effects, and liver or kidney disease could be contributing factors. Now let me tell you the complications of menorrhagia. Excessive or prolonged menstrual bleeding can lead to other medical conditions, including anemia. Menorrhagia can cause blood loss anemia by reducing the number of circulating red blood cells. The number of circulating red blood cells is measured by hemoglobin, a protein that enables red blood cells to carry oxygen to the tissues. Iron deficiency anemia occurs as your body attempts to make up for the lost red blood cells by using your iron stores to make more hemoglobin, which can then carry oxygen on red blood cells. Menorrhagia may decrease iron levels enough to increase the risk of iron deficiency anemia. Signs and symptoms include pale skin, weakness, and fatigue. Although diet plays a role in iron deficiency anemia, the problem is complicated by heavy menstrual periods. Then another complication is severe pain. Along with heavy menstrual bleeding, you might have painful menstrual cramps, dysmenorrhea. Sometimes the cramps associated with menorrhagia are severe enough to require medical evaluation. So I have yesterday I posted a video about and the day before yesterday I posted a video about dysmenorrhea. So please watch that video. That will be also very helpful to understand this problem. Coming to the diagnosis, your doctor will most likely ask about your medical history and menstrual cycle. You may be asked to keep a diary of bleeding and non-bleeding days, including notes on how heavy your flow was and how much sanitary protection you needed to control it. Your doctor will also do a physical exam and may recommend one or more tests or procedures, such as blood test. A sample of your blood may be evaluated for iron deficiency anemia and other conditions such as thyroid disorders or blood clotting abnormalities. Pap test. In this test, cells from your cervix are collected and tested for infection, inflammation, or changes that may be cancerous or may lead to cancer. Endometrial biopsy. Your doctor may take a sample of tissue from the inside of your uterus to be examined by a pathologist. Ultrasound. This imaging method uses sound waves to produce images of your uterus, ovaries, and pelvis. Based on the results of your initial test, your doctor may recommend further testing, which include sonohysterography. During this test, a fluid is injected through a tube into your uterus by way of your vagina and cervix. Your doctor then uses ultrasound to look for problems in the lining of uterus. Hysteroscopy. This exam involves inserting a thin lighted instrument through your vagina and cervix into your uterus, which allows your doctor to see the inside of your uterus. Doctors can be certain of a diagnosis of menorrhagia only after ruling out other menstrual disorders, medical condition, or medication as possible causes or aggravates of this condition. Now let me tell you the treatment. Specific treatment of menorrhagia is based on a number of factors, which include your overall health and medical history, the cause and severity of the condition, your tolerance for specific medications, procedures, or therapies, the likelihood that your periods will become less heavy soon, your future childbearing plans, effects of the condition on your lifestyle, your opinion or personal preference. Now let me tell you the medication. Medical therapy for menorrhagia may include non-steroidal anti-inflammatory drugs such as brufen or naproxen sodium help reduce menstrual blood loss. Non-steroidal anti-inflammatory drugs have the added benefit of relieving painful menstrual cramps, that is dysmenorrhea. Then another medicine which is commonly used is tranexamic acid, which comes with the name of Listida, helps reduce menstrual blood loss and only needs to be taken at the time of the bleeding. And then we can also prescribe oral contraceptives. Aside from providing birth control, oral contraceptive can help regulate menstrual cycle and reduce episodes of excessive or prolonged menstrual bleeding. Oral progesterone. The hormone progesterone can help correct hormonal imbalance and reduce menorrhagia. Hormonal IUDs. This intrauterine device releases a type of progesterone called levonorgestrel, which makes the intrauterine lining thin and decreases menstrual blood flow and cramping. If you have menorrhagia from taking hormone medication, you and your doctor may be able to treat the condition by changing or stopping your medication. If you also have anemia due to your menorrhagia, your doctor may recommend that you take iron supplement regularly. If your iron levels are low but you are not yet anemic, you may be started an iron supplement rather than waiting until you become anemic. Now let me tell you some surgical procedures to treat menorrhagia. You may need surgical treatment for menorrhagia if medical therapy is unsuccessful. Treatment options include dilatation and curettage, that is D&C. In this procedure, your doctor opens your cervix and then scrapes or suctions tissue from the lining of your uterus to reduce menstrual bleeding. Although this procedure is common and then often treats acute or active bleeding successfully, you may need additional D&C procedure if menorrhagia recurs. Then another procedure is known as uterine artery embolization. For women whose menorrhagia is caused by fibroids, the goal of this procedure is to shrink any fibroids in the uterus by blocking the uterine arteries and cutting off their blood supply. During uterine artery embolization, the surgeon passes a catheter through the large artery in the thigh, that is femoral artery, and guides it to your uterine arteries, where the blood vessel is injected with material that decrease blood flow to the fibroids. Then there is another procedure, that is focused ultrasound surgery. Similar to uterine artery embolization, focused ultrasound surgery treats bleeding caused by fibroids by shrinking the fibroids. This procedure uses ultrasound waves to destroy the fibroid tissue. There are no incision required for this procedure. Then we can also perform myomectomy. This procedure involves surgical removal of uterine fibroids. Depending on the size, number and location of the fibroid, your surgeon may choose to perform the myomectomy using open abdominal surgery through several small incisions, that is through laparoscopically, or through the vagina and cervix, that is stereoscopically. Then there is another procedure which is known as endometrial ablation. This procedure involves destroying the lining of your uterus, that is the endometrium. The procedure uses a laser radio frequency or heat applied to the endometrium to destroy the tissue. After endometrial ablation, most women have much lighter periods. Pregnancy after endometrial ablation has many associated complications. If you have endometrial ablation, the use of reliable or permanent contraception until menopause is recommended. Then another procedure is endometrial resection. This surgical procedure uses an electrosurgical wire loop to remove the lining of the uterus. Both endometrial ablation and endometrial resection benefit women who have very heavy menstrual bleeding. Pregnancy is not recommended after this procedure. Then the final procedure is hysterectomy. Surgery to remove which is a surgery to remove your uterus and cervix, is a permanent procedure that causes sterility and ends menstrual periods. Hysterectomy is performed under anesthesia and requires hospitalization. Additional removal of the ovaries, that is bilateral oophorectomy, may cause premature menopause. Many of these surgical procedures are done on an outpatient basis. Although you may need a general anesthetic, it's likely that you can go home later on the same day. An abdominal myomectomy or a hysterectomy usually requires a hospital stay. When menorrhagia is a sign of another condition such as thyroid disease, treating that condition usually results in lighter periods. So this was my video about menorrhagia, and till now, if you haven't subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And do not forget to post your comments in the comment section of this video. And if you have any other illness, please also type your comments so that I can make, if I get a time, I'll make a video about your illness. And if it's not possible, if I don't find a time, I'll try to reply to your comment as soon as possible. Okay. And if you think that my video provides some sort of benefit, please do not forget to give a thumbs up of this video or other videos of mine. And also, since this channel of mine with BB is basically to help humanity across the world, so please share my videos to help other people. Okay, thank you very much for watching this video. Bye.